All the slides presented here belongs to their respective owner. I or the channel does not claim any rights over them. Hello everyone, I am Shahan Laik. Welcome back to my channel, and today I will discuss about a very important topic in psychiatry, that is autism. Now, what is autism? Basically, autism is a spectrum of disorder. So, autism spectrum disorder is a neurodevelopmental disorder which is related with nerve. Some parts are related with psychiatry and development. So, why it is called a spectrum disorder? Because it is just an umbrella term which has so many different variety of symptoms and signs, which may also varies person to person, and with it may vary from male to female. So with everyone having different kinds of autism symptom, but in this video we will discuss only the common symptoms of autism. Autism is basically a kind of neurodevelopmental disorder where the child impairs its ability to communicate, to interact with the others. So basically the child is socially withdrawn, and the child also has some repetitive behavior, maybe flapping his hands, flapping his legs, and sometimes echolalia. That means lalia. Echolalia is a term which is used for a child who actually says what you are saying to him. So it is just that the child is giving you a echo and repeating your words. And the child also loses interest in activities. The child has lost interest in social, occupational, and functioning areas. So basically, this is a Mayo Clinic definition of autism, or autism spectrum disorder, ASD it is known as. So autism spectrum disorder, or ASD, is a neurodevelopmental disorder that impairs a child's ability to communicate and interact with others. So what are the early signs of autism? The early signs of autism is lack or developmental delay of speech, sometimes repetitive hand flapping, sometimes repetitive movements like movements of the toes, movements of the hands, movements of the a particular part of hand, movements of the head, and all these are repetitive movement. And the child also has impaired social skills. The child do not like to interact with others. The child don't like to play with others. The child is socially withdrawn. The child do not like crowded places. The child do not do eye contact with others, and the child likes to play alone. All these are the early symptoms of autism which can be noticed in a child if you look carefully in a child. Now, a very important thing about autism is that autism affects boys 3 or 4 times more than that of the girls. So, boys, male gender, are more affected. Family income, education, lifestyle don't seem to affect the risk of autism. So, autism has nothing to do with the family education, the family income, family lifestyle. So, it is something, a mixture of genetic and environmental problem. And exact number of children who is having this disorder is unknown, because generally the child is not diagnosed, and even the parents do not notice this peculiar behavior of the children. So the child go unnoticed, and there is we don't know the exact number of the children who are living with autism till now. Now, there are other disorders which are related to autism, like they have some similarities with autism, or may have some of the symptoms common with that of the autism, but it is not fully autism. It has very similarity with autism. The number one is Asperger syndrome. Asperger syndrome is similar to autism, but with normal language development. So Asperger syndrome is a patient having Asperger syndrome has all the symptoms similar to that of the autism, but except normal development of language. So in case of the autism child, the normal language development is hampered, but in Asperger syndrome, the child is having normal language development. Next, number 2 is Rett syndrome. So what is Rett syndrome? Rett syndrome is quite different from that of the autism, and Rett syndrome only occurs in female. But Rett syndrome is a relative disorder, developmental disorder, just like autism. But Rett syndrome is quite different from autism and it occurs only in females. Rett syndrome occurs only in females. This point is very important. Asperger syndrome, which point is important for Asperger syndrome? Always remember, with normal language development, that is important. All these points are important because questions are asked from these points. Another disorder is childhood disintegrative disorder. Childhood disintegrative disorder is a rare condition where the child learns skills, then the child lost the skill by the age of 10. So this is childhood disintegrative disorder where the child learns the skill but the child loses them by the age of 10. Next is pervasive developmental disorder. Pervasive developmental disorder is known as typical autism. Now, do you know what is the meaning of the term autism? It came from the word auto. Auto means self. Autoism. So, autism. That means the child loves to remain within the self. The child is socially withdrawn. The child do not like gathering. The child do not like to play with others. The child do not like to make eye contact with others. Now let's talk about the social interaction of this kind of children. Social interaction is very withdrawn and they do not like to play interactive games where people interact with others, and they are also not good in making friends. They do not like to make friends, and they also do not respond well when they are asked, when they are asked with their names. Sometimes they do not respond. They also don't like to eye contact with the person in front of him and do not smiles back when the other friends are smiling at him. The autism child will not actually autistic child will not smiles back and always avoids eye contact, and the autistic child shows lack of empathy. So there is no empathy in him, and they try to spend time alone rather than with others. So autistic child is a special child. So this picture is representing a autistic child, and the autistic child cannot speak how he feels. So that is why it is written here, I can't tell you how I feel. Regarding play and behavior of autistic child, uh, an autistic child does not imitate others. So if you put two or three babies together and with their own play blocks, the babies may imitate others in their playing. But autistic child always concentrate or remain focused in their own plaything, and they do not like other babies to interact with them, or they do not like to play with other babies, and they also do not like to share their car, share their plaything with others, and they do not smile back at others, and also they do not have a imaginative play. Generally children have a imaginative play. That means when a child plays, the child imagine the environment in which he is playing. So, and also pretends to play sometimes, but this autistic child does not pretend playing and does not have imaginative play. So that is the difference between a normal child and an autistic child. Behavior, what about the behavior of autistic child? An autistic child has a short attention. So the autistic child is has hyperactivity and attention deficit. An autistic child also has narrow interest range. This is a picture where I will say about the symptoms of autism in one picture. Now you see the number one is hyperactivity. This child shows a lot of extra activity, hyperactivity. Number two, prefer to play alone. This child do not like to play with other childrens. They like to play alone. Intolerance to sounds. If suddenly a loud sound comes, the child may get frightened, anxious, and they are intolerant. They do not like a loud sound. So intolerant to sounds, they do not like sounds, crowded places, noisy places, people shouting. They do not like all these things. Autistic child built in the object in a ruler, or always autistic child makes everything in a line. Like for example, a autistic child, if you give the autistic child 3 or 4 cars to play, the autistic child will put the cars in a line, just like a straight line. So that is why it is said that autistic child built in the object in a ruler. Autistic child do not has no eye following. So if you have a baby and you are showing the baby the moon, the baby will not respond to your fingers, not look at your fingers, and not look at the moon. But in normal child, if you just ask the baby and show the baby the moon, the baby, normal baby, will follow the path of your hand will and at last will look into the moon. But an autistic child will not follow your hand. So no eye following is there in autistic child. Delayed speech development. An autistic child do not follow the normal developmental milestone for speech. So the autistic child has developmental delay in speech. Maybe after so many years the autistic child is not speaking properly, or maybe speaking but less number of words. An autistic child is depressed. Autistic child has depression within them. They have anxiety, they have depression, they reject cuddles. They do not like that people cuddle them. People just come and just rub their cheek. They do not like all these things. They reject cuddles. And autistic child also have problem with their sleep. So they wake up in the middle of the night sometimes they have bad dreams, sometimes they have problems sleeping. So all these are the signs and symptoms an autistic child has. Basically there are 3 levels of autism. These are called functional levels of autism. It is autism level 1, level 2, and level 3. Now level 1 is mild, level 2 is moderate, and level 3 is severe. In level 1, that is mild, basically it requires support, and if you give support, maybe the child get back to the normal social interaction. In level 2, the child requires substantial support, so it is higher level than that of the level 1, so it is moderate. And level 3, the child is having severe ASD, severe autism, where the child requires very substantial support, because the child is in difficulty or distress, changing action or focus. And so basically what are the symptoms like in level 1, level 2, and level 3? Let us discuss. In level 1, the child is having difficulty initiating social interaction. The child is trying to social interact. Suppose there are three children. One child is having autism. You can see in the picture. I am describing level 1. So there is three children. One is having autism and the other two do not have any autism. So they are playing. The other two are playing with each other. And the first child who is having autism is trying to communicate, is trying to socially interact with the other child. So that is there in level 1. But because of having autism level 1, the child is facing difficulty. Organization and planning problem and hamper independence. That is level 1. In case of the level 2, the social interaction is now limited to a narrow spatial interest. Like the person is not going to interact with the other persons until the person has a requirement. For example, there is these three children in a classroom. The two who do not have autism, they are discussing, they are talking with each other, and the one with autism is sitting alone, and the autistic child will not communicate with other two friends until the autistic child requires a pencil or requires a rubber or requires a ruler. So when only required, then only this child will interact. So social interaction in level 2 is limited to narrow spatial interest. That is level 2. And what happens, and also frequent restricted repetitive behaviors. Repetitive behaviors are also seen in case of level 2. And what about level 3? In case of the level 3, it is very severe one, and severe deficit in verbal or non-verbal social communication skill is there. So the autistic child will not communicate with the other children in the room either verbally or non-verbally, maybe by gesture, by moving hand. That also the child will not do for communication, even in case of need. So this is a severe one. So the child is having great distress, difficulty in changing action or focus. As level 3 is very important, it is the most severe form of autism. So let me discuss it more. Now, the symptoms of autism level 3 is inability to use spoken language. The autistic child will not use or cannot use spoken language. The autistic child will be extremely sensitive towards crowd, towards bright light, towards loud noises. All these will make the child anxious, overwhelming, and the child will fear all these crowded places. The child will fear bright light. The child will fear attending marriages. The child will fear attending birthday parties. The child will fear attending anniversaries. The child will fear attending social gatherings. So all these will occur. The child also has low IQ, level 3 autism, low IQ. And the child has repetitive behavior, like I told you, flapping arms, flapping legs, flapping a part of the hand, flapping fingers, or maybe the child may be doing some repetitive behavior again and again. Many repetitive behavior like violent rocking, door slamming, all these repetitive behaviors may be there in the child. Another thing is physical symptoms like sleeplessness. The child cannot sleep properly at night, and also the child may have epilepsy, seizures, So all these are symptoms of level 3 autism, which is the most severe form of autism. Now this slide is for basically what is the treatment of autism. Can we treat autism? We can, but not fully. We can decrease the symptoms and we can control autism to a level. So basically we have medical treatments. 50% patients are prescribed medications by psychiatrists and they take the medication. And educational and behavioral treatment. Sometimes the autistic child is asked to join particular educational institute where they take care of the autistic child. They help the autistic child to grow more friends, to communicate with others. They help the child to develop social skills. They help the child to play together. They help the child to manage or organize a team. So everything they will teach. So that is educational and also behavioral therapy are needed, behavioral treatment. Because this autistic child, when they are asked to do social, they are asked to go for a social gathering or asked for playing together, the autistic child behave abnormally. So the autistic child has anxiety, depression within the mind, that also should be treated. And behavioral problem is also there in autistic child, that should be also treated. Sometimes the autistic child is also treated with diet treatments. Many parents turn to dietary supplements and elimination of the diet that alleviate the ASD. Some people believe that gluten-rich food can alleviate the symptoms of autism. You know, gluten is present in certain kind of food items like wheat. Gluten is also present in bread. It is also present in bakery items, cakes, pastries. All these items has gluten, so sometimes gluten-free diet is prescribed. Now, autism not only can be there in a children, but also it can be there in an adult. So generally after the treatment, an adult has improved social skill, improved communication skill, improved speech, and also the adult has improved his conditions like anxiety and depression. These are decreased in the mind of that adult having autism. So what are the strategies we need to cope with autism? For dealing with autism, we need to be look for support groups. These support groups actually help in developing social connection and also helps in learning social skill. And we need behavioral treatment, occupational therapy treatment. So all these will help along with dietary changes, like we need to follow strictly the gluten-free, dairy-free guidelines. Sometimes a child who is having autism has problem with milk products also, with ghee, with butter, with milk. So a autistic child can also be given food which is dairy free, and along with that the autistic child is given medication, support, and with the help of the doctor and the psychiatrist, psychological counseling, everything together can control the symptoms of autism to a certain level. Basically, what is the role of the treatment? What is the role of the medicine in treating autism? Basically, all these medicines which are given in autism are there to decrease the aggression in the child, to decrease the anxiety, to decrease attention problem in the child, to decrease the hyperactivity of the child, to decrease irritability of the child. mood swings, to decrease mood swings, to decrease the sleep difficulty of the child. So all these conditions are improved with the help of the medicines. So we need to be supportive, we need to take care of autistic child, and we need to understand that they are not misbehaving. They are having a problem, that is autism. We must be considerate towards them. Till now, autism is very difficult to understand and diagnose, and very little information is available about autism. And basically, autism remain undiagnosed in so many of the children. So in every house there may be autistic child which is in undiagnosed condition. Maybe the child is showing some frustration, showing some depression, showing some anxiety, showing some peculiar behavior like slamming the door, or maybe flapping hands, or the child is socially withdrawn, the child don't like to play with others. We as parents, we generally think that the child is misbehaving, and we generally try to handle the child rudely. But that is bad. We need to understand the psychology behind the mind of the child, because an autistic child is different, and they need special care, they need special support group, they need friends to cooperate with them. Sometimes it may be difficult to handle autistic kids, but if we give proper love, if we give proper care, if we help them, then surely they can gain back their social interaction, they can gain back their communication skills, and they can gain back language skills, and they can also communicate with their friends, they can play together. So everything can be got back if we become supportive to an autistic child. Thank you so much for listening this video, and if you like this video, make a thumbs up and please subscribe our channel for getting more videos like this. Bye bye.